So we have the privilege of being in Dr. G's office where he's going to check my ears.
Yes.
You guys went to elementary school together?
We went to junior high together,
Junior high.
Amit and I. And then he went to Brophy Catholic School and I went to St. Mary's. But we've always kind of like kept in touch for whatever reason.
Yeah.
Throughout the years. And I was watching KTLA one morning and I see him on there and I'm like, oh my gosh. And Brick saw it too.
Yeah.
And I was like, oh wow. I'm like, we need to interview my friend from...
What is your title?
So I'm a doctor, but I'm an audiologist. So think about a dentist who has a doctoral degree in dentistry. I have a doctoral degree in audiology.
Mm-hmm. And you see patients who have lost their hearing completely, or they're having hearing problems, they're starting to lose it?
Sure. We see all patients that have anything to do with hearing imbalance. We've got ringing in the ears, which is tinnitus, which if you've ever been to a loud concert, you get this little buzzing noise in your ears. That's called tinnitus or tinnitus.
You have that.
I have ringing in my ears
Yeah.
pretty much constantly.
Yeah.
I've gotten used to it. I don't think about it.
Mhm.
But at night, it's especially noticeable when I'm lying there, trying to fall asleep, and it's birds or crickets in my ears all the time.
Yep. So I have it too. And I have it in both ears. Now that we're talking about it, I can hear it. Usually I don't hear it. But because I know what it is, I know what caused it. There's all the nightclubs in Scottsdale.
Yeah.
All those nights, Access Radius and
Right.
all those places. So it really
Oh, so
damaged
it's
my
fun.
hearing and a lot of ringing in my ears. But you know what? Because I know what it is and psychologically I can tell myself, well, that's what it is. I don't have a tumor. Nothing else is going on medically. I can push it in the background. So today when we test your hearing, we'll do a couple of things and see about maybe taking it away.
Do you have that at all? No ringing.
Mm-mm. I mean, I have so many other problems. It's shocking that I don't have that problem.
You don't have any problems.
But I mean, I think, like when you get older, you see, I know my ex-father-in-law had a hearing aid and it was because he was swimming. He swam his whole life.
Mhm.
Does that ruin your ears?
So there's something called osteomas, which are little bony growths deep inside your ear when people swim in cold water. So a lot of surfers get it, so they call it surfers' ears, or a lot of swimmers get it, they call it swimmers' ears. But it's basically, it looks like little white pimples in there. So deeper you go inside your ear, you get into this bony area, and it just grows. And eventually those can close off your ear.
Oh, wow.
Oh,
So
wow.
usually we do a surgery or procedure to go in there and drill the bone.
Do you do surgeries?
I don't do the surgeries.
Okay.
But we'll refer out. We have plenty of very good otolaryngologists or otologists here in the valley.
When I was a teenager, I went to every rock concert there was in our area. I went to hundreds of shows.
Yeah.
And then as a young adult, I worked as a doorman in a rock and roll club, and I would often have to stand near the stage and monitor people who were slam dancing on the floor to live music, and
Yep.
so bombarded. And then I would listen with headphones to loud music, and then I was working in TV for 35 years, and I be in my ear, and I also spent a lot of time in war zones and loud explosions. So there's been a lot of damage done, I believe, over.
Absolutely.
Once you have damage done to your ears, can you reverse it?
Yeah, that's a really good question. So generally speaking, we have some people who had temporary hearing losses, like you've been to a concert and now you can't hear for 2-3 days, but then it comes back.
Right.
Or you go out shooting, right? You go out shooting, you don't have earplugs in, and you get this kind of temporary hearing loss in one ear or both ears, but then it comes back. So what happens is in the inner ear, if you look at the structure of the inner ear, it looks like a snail. And that's called the cochlea. And in the cochlea, there's a membrane, and there's tens of thousands
Like
of little
that right
cells.
there?
Like what's behind my head, absolutely.
Yeah.
So when we look at that, those little cells, essentially, that's what picks up the sounds. So we hear a sound, there's a little ocean wave that happens in there, these cells pick it up. Well, every time we damage our hearing, we temporarily knock those over, and then they come back up. They knock over, they come back up. At some point, some of these cells don't come back. And that's when we get a hearing loss. So we see a ton of veterans. So in our clinic, we work with the VA. Mm-hmm. So we see hundreds of veterans a year. They come in on the community care program. And so we see them, we test their hearing, we find out they've got this permanent hearing loss because, some are from the Gulf War, some are from Vietnam. We have one patient who's an Auschwitz survivor who was a warrior. Told us the story that he got stabbed by a Nazi and then he killed the Nazi, but his ears totally took this damage from all that noise, and so he's almost deaf. He's also got vision issues. So with hearing aids, we can provide him with better hearing. It's never going to be 100% normal hearing.
Oh, wow.
All right, well, I'm ready to get examined.
You ready to get examined?
Yeah.
I want to find out
Should I
what's
take it
going
easy on
on.
him or should I go?
No. Is it going to be like this when you're like a little and you get to go like this and then you get to go like that? Remember when you're little?
Oh yeah.
And you're like, wait, do it again.
We've upgraded. Now
Did you?
we have a button.
Oh, you have a button now.
Yeah, yeah.
Okay.
Oh,
I'm gonna-
I'm
gonna
less
fail
old
this.
school.
I'm gonna fail this test big time.
Are you?
Oh yeah.
Sitting right there.
Oh, wow, look at
I'm a little
this.
scared, not gonna lie.
Are you?
Yeah,
Don't be scared.
a little scared.
Don't be scared. So the first thing I'm doing is take a look inside your ears. This is called an otoscope.
Have you ever seen like any like really bad gnarly wax in the
I
ear?
got pictures. I'll show you some
I
pictures.
think I might have wax in my ears.
That ear looks spotless. Very
Is it good?
Oh really?
Yeah.
Spotless.
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 Yep, there's the osteoma right there.
Uh oh.
Yeah.
That doesn't sound good.
Saw something in
No,
there.
that's the little bony growth we were talking about for swimmers.
Really?
Yeah, I'll show you. I've got a little camera that hooks up to my phone, but that's not
Okay.
the best picture. I'll show you later.
It's funny because I always used my right ear for the IFB when I was doing TV because I didn't hear as well. I felt
the
like
left?
my left ear.
You've never had this done, Rick?
Not in a very long time. You say you still love me if I can't hear it, right?
Yeah. Of course.
All right, and this is the button. So I'll talk you through the earphones. So just push that button when you hear the beeps.
Okay.
I put his birthday as January 1st, 1980. That's correct, right?
No,
My
his birthday's tomorrow.
January
Or
24th,
the 24th.
1960.
1960.
Yeah.
Oh, I was close.
I'm old as mold.
So. All right, Rick, can you hear me okay? All right, we're going to start with that right ear first. So every time you hear a series of beeps, even if you can barely hear the beeps, push that button for me.
Good.
Yeah, I got it.
Let me take one look here and then I'll...
Okay. Oh wow.
Yeah, you see those two white things at the top there?
Yeah. They look like there's some kind of growth right there.
Those are the bony growths. We call them
Ew.
osteomas. And that's the eardrum right there. You can see the white shiny thing in the middle is just the reflection of the light from my camera. But the eardrum is generally round and pretty flat. A little bit of wax there, but if I took it out, it would just look like specks, so that's nothing.
But those things, they look kind of like polyps. So they
Correct.
grow.
Yeah, they're similar to bony polyps, basically.
Wow.
Yeah.
Shit, polyps grow everywhere. In your
Damn,
They
butt,
sure do.
That's scary.
in your uterus. It's gross.
So the red circles are the quietest sounds you can hear in the right ear, and the blue X's are your left ear. So the further down we go in the graph, the worse your hearing is. So we're starting with low-pitched sounds like your voice, my voice, most men's voices, background noise, going up to high frequencies, which are more women and children's voices.
Mm-hmm.
Now, any result above 20, so if I put my pen here, any result above my pen is considered to be normal hearing.
Uh-huh.
Anything below it is a hearing loss.
Wow.
Now, 20 is kind of the industry standard for normal hearing. 60 and below is considered to be a severe hearing loss. Okay, so if I put my pen here, you'll see up in the higher frequencies right up here, you're dropping down to a severe hearing loss, and then below 90 is considered to be a profound hearing loss.
Wow.
Okay, example, it's like a piano on the bottom, the left side of the piano, go to the right side. You
Yeah.
can hear the left side really well. When we get kind of to the right side of our hearing spectrum, it's really far down over here. You're
So does he
way
need a
past it.
hearing aid or not?
At this point, based on lifestyle, this is severe enough that I would say yes.
Really?
Wow.
Absolutely.
Wow.
Wow.
That's scary.
Let's do this one. I'm just going to put this in your ear, okay?
All right.
This is the color that we generally use with
With silver foxes?
the silver foxes, yeah.
You can barely see it. Let me see.
And that's the biggest one we have.
Oh, wow. They've
How do I
Pretty
really,
shiny. That one's pretty shiny, actually. I'd probably go a little darker.
you know, it's good for you.
I am getting old.
We all are.